Well, that was in the late 90s, actually, when we had those massive bleeding complications during coronary stenting. We were quite early in adopting a stent program. We had the Palmer shot stents available. And at that time, patients were heavily treated with all medications that we could find to prevent stent thrombosis, like heparin, Coumadin, aspirin, dextran, and so on. Well, that was in August '92, and we first did. And that in the early '90s, it was not routine to implant stents. So we first did balloon angioplasty on an LAD, and I remember that the first case took me over an hour, and most of the time was spent in cannulating the coronary arteries. I think I used 5 or 6 catheters before I could find it, you know. But it was a learning curve. Also, I had a learning curve. Yeah, that depends on your experience and where you are in your learning curve. But I know for sure that initially you have more radial artery spasm because you're really teasing the radial artery, because you need to manipulate the catheter maybe a little bit too aggressive, or you need more catheter exchanges. But in the course of time, you know, when you get used to the procedure and the procedure goes quite smooth and you're relaxed, the patient is relaxed, radial artery spasm is almost non-existent. If you have friction, it's usually mismatched between the artery and the material that you are using. But related to severe radial artery spasm, I had some avulsions of the radial artery, which of course is a serious complication. But you know, that's from over 20 years ago. Forearm hematomas by perforations, especially when you use hydrophilic wires and you enter a small branch. If you need to negotiate tortuosities, always be prepared that you might have caused a small perforation. So take a good look at the arm. If you had a difficult time in getting a catheter or a wire through the radial artery, I always, you know, give a little bit more compression over the forearm when with a bandage, just to be sure. And I instruct the nursing team to do controls every hour of the arm, just to, you know, be ahead of the problem. Fortunately, no ischemic events. There are case reports on ischemic hand events, which is of course a terrible complication, but it's anecdotal, and so that's. I must say that it's all relatively mild. There are severe complications, but they are very rare.